Hello, I'm Dr. Meredith Watson-Locklear, and I am an OBGYN at the new Orlando Health Women's Pavilion located in Winter Park. Very frequently, I get asked what is normal when you're talking about vaginas. The great thing is that you don't really have, there's not a normal. Everybody's different. You can have different color. You can have different amounts of hair. The labia or the vulva or the lips can all be different shapes and sizes, and it's all can be still completely normal. The lips or vulva or labia should be skin colored, basically. However, it can vary in color and shade as well. It could be a little bit darker. It could be a little bit lighter. One thing that I do encourage you to do is continue to look, continue to check. And then if something new pops up, if something changes, especially if you get one particular spot that's lighter than another or darker than another, it's always super helpful to follow up with your gynecologist to make sure that if something is abnormal is going on. So it is super common for women to have lumps and bumps and different areas that pop up down below on your labia, your vulva, and even on the inside of your vagina. You have lots of glands down there that are making lubrication, making oil that is normal down there for you, and just with mucus, with the coming out of the cervix and things like that. So those glands can get covered up with skin, either from friction or from heat or from things rubbing together, and you can actually get those glands that can swell, and it acts like a pimple almost. So just like you can get acne on your face, you can actually get acne down there as well. Typically they resolve on their own and they don't usually cause anything other than some mild irritation. But if it's swelling, if it's really significant, if it's painful to sit, if it's painful to have sex, if it's painful to wear underwear, those things aren't normal and you should definitely see your doctor. Vaginal dryness can be a super common issue across all ages. In the premenopausal woman, vaginal dryness can be caused by hormonal changes most frequently. It varies based off of what your hormones are doing throughout your cycle. If it has something to do with the beginning of your cycle, when you ovulate, even right before you actually start your period, your hormones can fluctuate throughout the month, and it can affect your vaginal dryness. The libido also can have an issue with that as well and can affect your ability for dampness during sex or even just walking around throughout the day. Vaginal dryness can be addressed with over-the-counter lubrication, and lube is great, so we encourage you to do those things as well. And if it's persistent or it is getting worse, it's definitely something to talk with your doctor about. For postmenopausal women, vaginal dryness is a very frequent issue, and it's frequently caused by a lack of hormone in the vagina. And it can be something as simple as it only bothers them during sex. It can be something that can bother postmenopausal women when urinating. In severe cases, it can bother women when they just sit down. So those are definitely things that can be addressed with your doctor, and sometimes just over-the-counter lubricant can help, but sometimes some additional treatments are needed as well. Irritation in the vagina is a super common thing. Can be something as minor as, oh, I just have a little itch, just like you do when on your skin somewhere if you get a little irritation. Minor irritations usually will resolve on their own and they'll go away without you having to do anything. There's lots of different causes of irritation. It can be things as if you have new underwear, if you have new soap, if you have a new detergent, if you worked out for a really long time and kind of ran around in your gym clothes and went to the grocery store, those types of things. Lots of different things can cause the irritation. As long as the irritation gets better on its own and it's not persistent, it doesn't last for a long time, it's not getting worse, and you're not developing other symptoms, it can be completely normal and things can change here and there. But if you start developing worsening symptoms, they just keep going past, more than a few days, especially if you get things past a week, it's definitely something to check with your doctor about. Women ask me all the time, what is up with the vaginal discharge? I have people who come in all the time and want to know, is this normal? Is it not normal? What's going on with that? So vaginal discharge in general can actually be totally normal. Just depends on where you are in your cycle. When at the time that you ovulate, your vaginal discharge can actually get pretty runny and can be completely normal. And even before you start your menstrual cycle, it can change as well. Different things that can cause vaginal discharge can be things like changes in your soaps, your detergents, pH levels in the vagina. Stress, believe it or not, can actually affect your vaginal discharge as well, especially if it throws off your pH and your normal bacteria. And then, of course, we worry about things like infection can also affect vaginal discharge. Reasons to see your doctor are going to be if you have, again, persistent discharge, but also associated with if it itches, if it burns, if it smells really bad, if it really burns when you pee. Any of those things are reasons for you to follow up with your doctor. So another frequent question we get is, what's going on with my vaginal odor, smell, those types of things. So things I tell patients all the time is that a vagina should smell like a vagina. And so it's not going to be odor free. It's going to have the smell like a vagina, and everyone smells different. Just like people, when you walk by people, everybody kind of has their own scent. That includes the vaginal area as well. The easy thing to remember for patients is if it doesn't offend you, it's not likely offending anyone else. It's not uncommon for you to have occasional pain during sex, and there's several different things that can occur that will cause that. And so something as simple as just vaginal dryness based off of where you are in your menstrual cycle, that can cause some irritation and some pain during sex. And doing something as simple as changing up, adding in some lubrication, that can make a difference. Sometimes you will get certain pain with sex if you're in a certain position during sex. And so sometimes being more creative and changing things around can help with that. When it's mild, when it's only every now and then, when it doesn't occur all the time and it just resolves on its own and it doesn't persist, then that can be totally normal. When we get concerned and we want you to start following up with your doctor is if it continues, if it's getting worse, if it's painful every single time you're having sex, then that's not A, not fun, and B, probably not normal. So something that you need to definitely follow up with your doctor for. Thanks for watching. I'm Dr. Meredith Watson-Locklear, and again, I'm over at the Orlando Health Women's Pavilion in Winter Park.